Thanks so much for staying with us here on Morning Live. Now we continue our conversation. This is a follow-up from a series of interviews that were done last week by Leanne, and it speaks to medical aid schemes and unfair discrimination against certain groups of medical practitioners. Now, the group that was here last week kicking off the series of interviews claimed that the GEMS medical aid scheme subjects them to unfair audits and is circulating a list of names of Black and Indian healthcare practitioners that are blacklisted. And we ended on that note before the news, where I was putting it to you that the minister was absolutely clear that you do not have the right to blacklist any practitioners, and you also do not have the authority or the right to withhold any payment from them. And this is exactly what the group of aggrieved practitioners is accusing GEMS of.
Thank you, Sakina, and I want to put on record again that GEMS is registered as a closed scheme under the Medical Schemes Act. We regulated by the Council for Medical Schemes, and Section 59 of the Medical Schemes Act allows a scheme to either pay the practitioner or the member, and in a very small number of practitioners, after an extensive investigation, we make the decision in the interest of our members to rather pay the member than the practitioner. But in the vast majority, over 30,000 practitioners and providers and facilities, twice a month, we pay between 2 and 3 billion rand a month directly to healthcare practitioners and providers.
So you are claiming to be innocent of those charges brought against you?
Absolutely. We act within the law and we act within the Medical Scheme Act, always in the interest of protecting our members.
So the members who were here last week, they brought a list that we took a look at, and we went through it line by line, and without fail, it was either a Black or an Indian practitioner. Is it coincidence?
So, Sakina, the key point I can make to you, which I made earlier, is that when we register a healthcare practitioner or a provider or a facility, it's based on what we call a PCNS number that is obtained from the Board of Healthcare Funders. In their database, there's no race classification. Equally, in the GEM system on providers, there's absolutely no race classification. We can give the absolute assurance that we do not racially profile. GEMS is absolutely against it, and we would not do that 25 years into our democracy.
So how do you respond then to claims and allegations that there are doctors, there are healthcare practitioners who have taken their own lives, whose lives have been decimated as a result of your actions as a medical aid scheme?
So, Sakina, from our point of view, what we want to emphasize is that we're responsible for 1.8 million beneficiaries. Healthcare professionals are an absolutely integral part of the healthcare system. We value what they do, and we would not want to be part of any action that results in that kind of situation for healthcare professionals.
So you stand by that list that you are circulating?
We stand by protecting the interests of our members.
And you are claiming innocence with regard to all the charges that have been put to you?
Absolutely. We operate, as I've indicated, within the law, within the Medical Schemes Act, regulated by the Council for Medical Schemes. And that's why we welcome this investigation that will specifically look at Regulation 59. All of the stakeholders, including the National Healthcare Practitioners Association, were there. We were there as GEMS. We were represented, and we support this investigation. And what we're all saying is that this is a priority investigation to bring clarity in the findings to these very important and serious allegations.
Well, thank you so much, Dr. Guni Goolab, who is the Principal Officer of GEMS, talking to us about the allegations of racism from medical aid schemes towards Black and Indian healthcare workers. And of course, we heard last week there will be some form of inquiry with regard to this matter, given what has emerged. And